The following presentation is designed to educate student athletes, coaches, parents, and administrators about concussions, Vermont state law, and safe return to the field and the classroom. This presentation was brought to you by students in the athletic training program at Castleton State College. Thank you for your time. A concussion can occur whenever the head makes contact with something, or violent jarring or shaking takes place. This can result in a disturbance of brain function. Concussions can result in chemical changes to the brain. These chemical changes result in physical, emotional, and cognitive symptoms. For this reason, concussions are considered traumatic brain injuries and should be taken seriously. According to several articles within the Journal of Athletic Training, concussions account for 9% of all sports injuries. 30% of all concussions in individuals between 5 and 19 years of age are sports-related. 300,000 sport-related concussions occur annually and usually in ages 15 through 24. This means it could happen to you, your athlete, your student, or your child. Act 68 is an act relating to health and schools. This law requires schools to educate, acknowledge, remove, return, and have an action plan. This law also develops guidelines to assist schools in taking reasonable steps to prevent and to minimize the effects of concussions. Schools must educate their coaches, their athletes, and their athletes' guardians. For this reason, you are watching this video and listening to us right now. There are guidelines that must be followed to ensure a student-athlete's safety once they have sustained a concussion, including immediate removal from activity and specific steps for returning to their sport and the classroom. These will be discussed later. Concussions can occur in any and all sports, not just football, which is a common misconception. Of course, there is higher risk in participating in both collision and contact sports, but head injury is relevant for any student-athlete. The most common way to sustain a concussion is player-to-player contact. If you've sustained a concussion before, you are 2 to 5 times more likely to get another. Risk factors that may influence your concussion or prolong your recovery include previous concussion, female gender, age, sport played, position played, migraines, mood disorders, learning disabilities, and sleep disorders.
It's important to understand that no helmet, mouth guard, or any other form of protective equipment can protect against forces causing concussion. Ensuring that student athletes are using correct technique and are educated on concussions is the first step in preventing head injury. Baseline assessments, though not always possible, are another way to help. Adherence to game rules by players is a way you can protect fellow student athletes from harm. Coaches can also limit the number of contact practices, and again, education is key. So how do you know if you have a concussion? How does your coach, your mom, or your teacher know? Symptoms for concussions may not appear right away. Sometimes, a concussion is referred to as an invisible injury because the athlete may appear to be fine. Further investigation is necessary. Every brain is different, and so is every injury. Student athletes will all react in a manner individual to themselves. Some signs and symptoms, however, are universal for a concussion. Studies have shown that gender affects reactions to concussions. Girls may experience symptoms such as drowsiness and sensitivity to noise more often, where boys may experience more brain function problems, such as amnesia, confusion, and disorientation. Just like all student athletes will react differently, they will all recover differently as well. It may take one athlete a week to be symptom-free, while it may take others months. Being overcautious when an athlete takes a hit to the head is something that often occurs in youth and high school sports. Having a trusted adult around with specific training is the only way to truly determine if the head injury has occurred. Managing a concussion once it is sustained begins with removing any athlete suspected. Sideline evaluations must be completed by a licensed healthcare professional trained in the evaluation and management of concussions. Coaches can remove athletes from play if they suspect a concussion. However, they are not qualified to diagnose a concussion. The student athlete should be observed and monitored in case of worsening symptoms. There is no same-day return to play for an athlete suspected of having a concussion. Athletes must get plenty of rest to ensure quick recovery. This includes physical rest as well as mental. Athletes should avoid activities that are physically demanding or require a lot of concentration. They should avoid driving and should definitely not consume alcohol. This and other drugs will slow recovery and put you at risk of further injury. Using medication for symptom relief is acceptable 10 hours after the injury was sustained. You should check with your healthcare provider before taking any medication. Most pain medications, nonsteroidal anti-inflammatory drugs, are blood thinners, and this is something to avoid when dealing with head injury.
Although there are strict guidelines and protocols involving student athlete return to play, there are no standardized guidelines at this time regarding return to school. Student athletes will require academic accommodations such as reduced workload, extended test taking time, days off, or shortened school days. Students, be honest with your family and your teachers. Your health and safety is their main concern. Once it has been determined that an athlete has sustained a concussion, a return to play protocol will be followed. Student athletes should not begin their return to play until they have completed a full day of school. Then there is a 6-step protocol that begins with no activity. You must be symptom-free for 24 hours before you can move on to the next step. If during one of the steps you become symptomatic again, you must rest until the symptoms go away. Once you are asymptomatic, you can begin with the previous step. Repeat this process until you've completed full play, symptom-free. This one goes out to all the student athletes in the room. Consider your future. You are young adults and you have so much life left ahead of you. Be smart. Tell a trusted adult if you think you have a concussion. Be honest with how you are feeling. Do whatever you can do to get yourself better. And recognize that high school sports are a big deal right now, but they won't always be. The health and safety of your brain is so very important. This is especially true because at your age, your brain is still developing. It will not be fully developed until your 20s. A concussion can seriously interfere with the progress your brain can make. So take a step back and consider the bigger picture and trust that your coaches, athletic trainers, and yes, your parents have your best interests in mind. According to the Vermont State Concussion Law, Act No. 68, each school must have an action plan with the following policies. At this time, your administrators will share with you how this action plan is carried out within your school.